All right, my name is Jared Alexander. Here's my sheet of paper and my notes on the other side that help me just locate things. So I went ahead and dissected the brain here. So what I had before I split it, we got our longitudinal fissure, frontal lobe, and parietal lobe, occipital lobe. Here is the cerebellum with the arbor vitae as well present, and it's a temporal, parietal, and here I have the gyri, which are the prominence of the wrinkle, so to speak, and then the creases are the sulci. I will also show the meninges that I removed. So I got the pia mater right here. I had a bit of a sheep brain actually that it was attached to. I could see the subarachnoid as well, with it's carrying some vessels, and the tough layer, the tough mother, was the dura mater as well. And here's a piece. This came from over the longitudinal fissure, and you can even see the vein that was running through it. And so here's the cerebral cortex, white matter, corpus callosum, thalamus, and then there is right here as part of the midbrain. There's a bit of a pineal gland, and I also got some mammillary bodies. I believe this is a pituitary gland. A little bit difficult. I'm looking using the sheet here. This helped me out quite a bit when I simply removed the medulla oblongata and along the most of the cranial nerves. So right here I have part of the midbrain and the brainstem right here, and I removed the portion where it was going down right here with the start of the spinal tract and the brainstem. So here is that piece right here. So as you can see, this is the start, part of the ventricle, and the start of the spinal tract, the brainstem. The brainstem becoming the spinal tract, attached with the meninges as well to show. And coming right here, you can see a bit of the the optic chiasm. And then inside, right here, the hypothalamus, and so I have the pons as well, the optic chiasm, the pons, as I mentioned earlier, medulla oblongata, mammillary body, and that should be it. Want to show this piece right here, part of the diencephalon here, and the limbic system a bit coming around, and that's the little pituitary. I'm doing things backwards because I'm looking in the camera here. Right there, pituitary. And just to go over again the lobes, occipital, so occipital, frontal, parietal, lateral fissure. This would have been the longitudinal fissure that ran anterior to dorsal to ventral, posterior to anterior. We went over the frontal, the parietal, and the temporal lobe. And the fissure separates between the lateral fissure, longitudinal fissure separates between the left and the right hemisphere, and the lateral fissure separates between the occipital and parietal as well. Went over the corpus callosum, thalamus, the hypothalamus. To go over again, the thalamus right here, and the hypothalamus was right in there. It came with it and attached to the pituitary. Looks like that little guy right there. And I believe there's a piece of the hypothalamus there too. Okay, that's cerebellum, arbor vitae, midbrain, brain stem, and the spinal cord, or start of the spinal cord from the brain stem, the meninges, outer layer, dura mater, subarachnoid with the vessels that go in and out, and with part of the blood-brain barrier, and then the pia mater, which was the closest, the soft mother. Went over the white matter. As you can tell, it looks white. Cerebral cortex, outer layer with some gray matter, which are neurons that make up that. It's rich in the neurons. That is all I have. Thank you for watching.